All right, welcome back to Discussions with Dr. G, where we will be discussing upper respiratory medications. We are going to explore all the glamorous ways that your nose can betray you. I'm Dr. G, your sarcastic nursing professor, and let's be honest, part-time tissue distributor. Before we start, though, you will notice today that I am going to give you both the generic and the trade names for many of these meds. Testable material will fall on the generic name. The trade names are just to help you make more sense of what we will be discussing, okay? Good. So let's start with the basics. What are the usual suspects when it comes to coughs and sneezes? We're talking colds, sinusitis, rhinitis, pharyngitis. Basically, if it makes you sound like you're auditioning for a NyQuil commercial, it's probably on this list. Now, here's the thing most people don't want to hear. Most of these causes are viral. Yes, viruses, not bacteria, which means for the love of all that is holy in the world, antibiotics are not going to be the magic fix. I can't tell you how many times I've had someone come to me, clutching a wad of soggy Kleenex, looking at me like I'm the last hope before they write their will, and they say, "Do you think I should go to the doctor and get some antibiotics? I have a cold." Hey, I have to do my best not to roll my eyes so hard that I see my own brain. I mean, I get it. You feel miserable. But antibiotics are not going to help you with a virus. They're just going to mess up your gut and make superbugs. Most of these illnesses are self-limiting, which is a fancy way of saying your body will handle it eventually, even if you feel like you're dying in the meantime. So, before you start raiding your medicine cabinet or texting your other nurse friends at 2 a.m., please don't. Just remember, sometimes you just need rest, fluids, and maybe a little bit of patience, and a whole lot of tissues. All right, so let's talk the meds, because let's be real, nobody just wants to sit around and wait it out. We've got a whole arsenal for upper respiratory misery, but you got to know what you're taking and why. First up are antitussives. These are your cough suppressants. Codeine is the classic go-to. It works on your brain's cough center, but it's an opioid. So yeah, it'll stop your cough, but it also might stop your breathing if you're not careful. Sedation, constipation, and don't even think about giving it to kids. I mean, unless you want to explain to your boss why you're suddenly out of a job. Then there's dextromethorphan, or DM. It's the non-opioid version for antitussives. So you don't get the narcotic effects unless you chug the whole bottle, which, believe it or not, some people do. Hallucinations, euphoria, the whole 9 yards. So yeah, don't do that. Stick to the recommended dose or you'll be seeing pink elephants instead of just blowing your nose. Okay? Next, expectorants. Guaifenesin, also known as Mucinex. This one's for when you want to actually get the mucus out. It thins your secretions so you can cough them up and stop harboring them like some weird mucus dragon. Just be ready for a little nausea, possibly some drowsiness, and you're going to want to drink water. Lots and lots and lots of water. Expectorants don't work without water. Mucolytics, like acetylcysteine, are for real heavy-duty mucus. This stuff breaks down the gunk so it slides out easier. It's also the antidote for Tylenol, or acetaminophen, in an overdose, but that's a whole nother episode. Just remember that it smells like rotten eggs. If you've ever had to give it, you'll remember to do it in a well-ventilated area. Okay, unless for some reason you're into sulfur-scented perfumes. Decongestants, pseudoephedrine and phenylephrine. These shrink your nasal mucosa so you can finally breathe through your nose. But don't get too excited. If you use nasal sprays for more than 3 to 5 days, you get what's called rebound congestion, which is basically your nose's way of punishing you for overdoing it. And if you have high blood pressure, these are not your friends. Antihistamines. First generation, like diphenhydramine, aka Benadryl, will knock you out, dry you up, but also make you feel like a zombie. Second generation, like, ready? Loratadine, which is Claritin, cetirizine, which is Zyrtec, or fexofenadine, which is Allegra. These are less sedating, so you can actually function and work. Just watch out for the duplicate antihistamines and combo meds such as Alavert D12, which contains pseudoephedrine and loratadine, or chlortripolone, which contains pseudoephedrine and loratadine. Okay? Finally, nasal glucocorticoids. Think fluticasone, also known as Flonase, or mometazone, also known as Nasonex. These are the big guns for allergies. They take a few days to work, so don't expect instant relief. You're going to want to use them every day, not just when you feel stuffy. And for the love of your nose, learn the proper spray technique. Blow first, spray away from the septum, and don't sniff like you're trying to inhale a pizza. Now, let's get real about what nurses wish you knew. First, more is not better with over-the-counter meds. I know the logic is tempting. If one pill helps, 3 must be amazing, right? No, wrong. That's how you end up in the ER with your liver waving a white flag. Always check what's in your combo meds, especially for duplicate antihistamines or decongestants. And if you're using a nasal spray, please don't just jam it up there and hope for the best. Blow your nose first, aim it away from the septum, and don't sniff so hard you give yourself a headache. Watch out for sedation, especially with opioids and first-generation antihistamines. If you're feeling drowsy, maybe don't operate heavy machinery. Or, try to crochet a scarf, as you may end up crocheting your hands into the scarf. Antibiotics are not for viruses. I know it's frustrating, but trust me, you don't want to mess with antibiotic resistance. So, next time you're feeling stuffy, remember, check your meds. Use them safely. Don't be afraid to ask questions. And if your nurse is crocheting while talking to you, it's not because she's ignoring you. It's because she's explained this 1,000 times and she's just trying to keep her sanity. That's it for today's episode. Keep those questions coming. And as always, may your mucus be minimal and your meds be manageable.